Every second, your kidneys work silently to keep your body alive. They are the body's natural filtration system, essential for maintaining homeostasis. They remove toxins, balance fluids, regulate electrolytes, and filter waste products from the bloodstream, ensuring our internal environment remains stable. But when the kidneys stop functioning properly, dangerous toxins and excess fluids begin building up inside the body. This is a critical medical state. As these wastes accumulate, they affect every organ system. Without intervention, this buildup leads to a condition known as uremia. This can lead to severe complications, including high blood pressure, pulmonary edema, heart failure, metabolic acidosis, and life-threatening electrolyte imbalances. That is where dialysis becomes a life-saving treatment. It is an artificial process used to remove waste when the kidneys can no longer perform these functions. There are two major types of dialysis: hemodialysis and peritoneal dialysis. Each has unique procedures, benefits, and nursing considerations. Let's begin with hemodialysis. This method involves an artificial kidney or dialyzer to filter the blood externally. Before hemodialysis can begin, a vascular access site must first be created. This is the patient's lifeline to the dialysis machine. One common access method is called an AV fistula. In this procedure, a surgeon directly connects an artery to a vein, usually in the patient's arm. Over time, the vein becomes larger, stronger, and thick enough to handle the high blood flow required for repeated dialysis treatments. For nurses, assessing the fistula is critical. You must palpate for a thrill or vibration and auscultate for a bruit or whooshing sound to ensure patency. Another method is an AV graft. Instead of a direct connection, a soft synthetic tube is surgically placed between the artery and vein. For temporary or emergency access, a central venous catheter may be used, though it carries a higher risk of infection and clotting. Once the access site has healed, the treatment begins. The patient is connected using two needles, one to carry blood out and one to return it. One needle carries blood out of the body toward the dialyzer machine. The second needle returns the cleaned blood back into the body. As blood enters the dialyzer, it passes through thousands of microscopic filtering fibers. These fibers act like an artificial kidney. Inside the machine, a special cleansing fluid called dialysate flows around the filtering membrane, creating a concentration gradient. Through diffusion and ultrafiltration, toxins, waste products, and excess fluid are removed from the blood and into the dialysate. The purified blood is then pumped safely back into the patient's bloodstream, restoring a healthy balance to the body. A major nursing priority during HD is monitoring for hypotension. Signs like yawning, nausea, or muscle cramps can signal fluid is being removed too fast. If hypotension occurs, the nurse should place the patient in the Trendelenburg position and may administer a saline bolus as per protocol. Watch for dialysis disequilibrium syndrome, especially in new patients. Rapid solute removal can cause cerebral edema, leading to headaches or confusion. Access site visibility is vital. Never cover the needles with blankets, as dislodgement can lead to rapid, life-threatening blood loss. Now let's understand peritoneal dialysis. Unlike hemodialysis, peritoneal dialysis filters blood inside the body instead of outside. A soft, flexible catheter is surgically inserted into the abdomen near the belly button. This becomes the permanent access point. Each treatment session is called an exchange. This process involves 3 distinct steps: filling, dwelling, and draining. The first step is filling. Sterile dialysate fluid flows through the catheter into the abdominal cavity, where the filter is the body's own lining. Once filled, the fluid remains there for a specific period called the dwell time, typically lasting several hours. During this phase, the peritoneal membrane acts as a natural filter. Waste products and excess water move from tiny capillaries into the fluid. After the dwell phase is complete, the used fluid containing waste products is drained out into a disposable collection bag. Nurses must teach patients to inspect the effluent. It should be clear. Cloudy fluid is a primary indicator of peritonitis, a serious infection. Watch for the classic triad of peritonitis: cloudy effluent, abdominal pain, and fever. Immediate medical intervention is required. Dietary management is one of the most significant challenges for dialysis patients. Education is a key nursing role. Potassium is the silent killer in renal failure. Patients must limit high-potassium foods like bananas and potatoes to prevent cardiac arrhythmias. High phosphorus levels can lead to brittle bones. Nurses teach patients to take phosphate binders with every single meal to prevent absorption. Fluid restriction is vital for HD patients. We teach strategies like sucking on ice chips to manage thirst without exceeding daily limits. Interestingly, while CKD patients restrict protein, dialysis patients actually need more protein as the treatment removes essential amino acids. Recent 2025 updates highlight the management of acute kidney injury requiring dialysis. Nurses must monitor for early signs of renal recovery. Telehealth is also expanding, allowing renal nurses to provide remote monitoring and education for the growing home dialysis population. Beyond the technical care, providing psychosocial support is essential. Dialysis is a lifestyle change that requires significant emotional resilience. In summary, hemodialysis filters blood outside the body via a machine, while peritoneal dialysis uses the body's own abdominal lining. Both are life-saving treatments. As future healthcare professionals, your vigilance and education are what help patients live healthier lives. Thank you for watching this comprehensive guide. Don't forget to subscribe to the channel for more nursing content and clinical tips. Understanding these procedures is essential for healthcare professionals and caregivers around the world. We'll see you in the next lesson.